Welcome to Senior Health Video. This video will talk about 13 hidden heart disease warning signs that you must check today. Has he ever looked in the mirror and felt a brief moment of concern as he noticed a small change in his skin or eyes and wondered if it could be a warning he should not ignore? Many Americans, especially those in their 60s or older, know that feeling well because they understand how heart disease often begins quietly. It rarely announces itself with sudden pain. Instead, it shows up through subtle clues on the outside long before the danger on the inside becomes serious. That is why this conversation matters now more than ever, because the earliest signs of heart trouble are often visible right on the surface. And yet most people walk past them without realizing what their body's trying to say. He may feel perfectly fine. His blood pressure might look normal. His cholesterol numbers may not seem alarming. But hidden heart problems can still be developing silently, and that silence is what makes early detection so critical. When he learns to recognize what these surface changes truly mean, he turns uncertainty into awareness and fear into action. Simple details around the eyes, the nails, the legs, or the earlobes can reflect changes in circulation, oxygen levels, or inflammation even before symptoms start. And understanding these details gives him the chance to seek care early and protect his long-term health. That is exactly why this video guides him step by step through 13 visible signs that doctors pay close attention to. Each sign tells its own story about what may be happening inside the heart, and as he moves from one clue to the next, the meaning becomes clearer. By the end, he will understand how these small changes connect and why paying attention to them could make all the difference for his future. Number 1, Frank's sign. When the viewer first hears about an earlobe crease, it may sound too simple to matter, yet this small detail carries a surprisingly powerful message. Frank's sign is a diagonal crease on the earlobe that can reflect early vascular aging and increased heart disease risk. Doctors pay close attention to it because the earlobe has no fat layer and is supplied by tiny blood vessels that react quickly to changes in circulation. When those vessels stiffen or lose flexibility, the skin begins to fold in a way that often mirrors what is happening deeper inside the coronary arteries. Scientists from major American heart centers have noted that deep, noticeable earlobe creases are more common in people with arterial plaque and impaired blood flow, even when they feel healthy on the outside. One patient's story highlights this clearly. A 72-year-old man came in only because his granddaughter asked about the crease on his ear. He believed it was normal aging. A simple heart scan later showed early blockage that had been building for years without symptoms. That single surface clue gave him the chance to change his diet, increase his activity, and begin treatment before a heart attack ever formed. Frank's sign becomes a reminder that the body often speaks before pain appears. But only knowing this sign is not enough, because what comes next exposes an even more dangerous clue hidden around the eyes. Number 2, xanthelasma. As we move from the earlobe to the eyes, the clues become even more striking because the next sign is something people notice in the mirror, yet rarely understand. Xanthelasma appears as soft yellow patches on the upper or lower eyelids, and it is one of the clearest surface warnings that cholesterol is silently building inside the body. Many Americans think these patches are harmless cosmetic changes, but the truth is far more serious. These deposits form when excess cholesterol seeps into the skin, where immune cells swallow it and turn into foam cells, creating visible yellow clusters. Doctors in major heart clinics report that xanthelasma is strongly associated with higher cardiovascular risk, even in people whose cholesterol tests look normal, which surprises many patients. One memorable story came from a 40-year-old woman who believed her eyelid patches were simply signs of aging. When she finally asked about them, her doctor ordered a full lipid panel and a scan which revealed a genetic cholesterol disorder that had already created plaque inside her arteries. Her decision to question a small change on her face gave her the chance to start treatment and prevent an early heart attack. The practical solution begins with checking cholesterol levels, increasing fiber, focusing on heart-healthy fats, and limiting processed foods because the eyes can show what the blood cannot. But only knowing this sign is not enough because the next warning can appear on the hands and feet and tells an even more dangerous story about cholesterol overload. Number 3, Tuberous Xanthomas. Moving from the eyelids down to the hands and feet, the warnings become even harder to ignore because tuberous xanthomas are one of the strongest visible signs that cholesterol levels have reached a dangerous extreme. These lumps appear as firm yellow nodules on the elbows, the knees, the heels, or the backs of the hands, and they develop when cholesterol becomes so elevated that the body begins storing it in the skin itself. Many viewers mistake them for calluses or small injuries, yet their presence often means the bloodstream has been overwhelmed for years without detection. Doctors in lipid clinics across the United States agree that tuberous xanthomas are closely linked to severe genetic disorders like familial hypercholesterolemia, a condition that raises the risk of early heart attacks by several times. One patient story illustrates this clearly. A 51-year-old man arrived at the clinic with small lumps on his Achilles tendons that had been growing slowly for decades. He believed they were from old sports injuries. After proper testing, his doctor discovered that his LDL cholesterol was more than double the safe level, and scans revealed plaque buildup that had already narrowed key arteries. That discovery changed the course of his life and allowed him to begin treatment before catastrophe struck. The solution begins with a full lipid panel, family screenings, heart scans, and a heart-healthy eating pattern, rich in fiber plant oils and omega-3s, because these lumps often appear long before symptoms. But only knowing this sign is not enough, because the next clue hides within the eyes and warns of a silent problem that can start even before age 45. Number 4, corneal arcus. As we move from the skin back to the eyes, the next sign becomes even more revealing, because corneal arcus is a visible white or gray ring that forms around the iris and can appear years before a major cholesterol problem is diagnosed. Many viewers assume it is a normal part of aging, and in older adults it often is harmless. However, when this ring shows up in someone younger than 45, it becomes a powerful warning that cholesterol is circulating at levels high enough to leave a mark on the eye itself. The eye is one of the most sensitive windows into cardiovascular health, which is why this detail deserves close attention. Doctors at leading American heart institutes have noted that corneal arcus in younger adults is strongly linked to higher LDL levels and early plaque formation, even when symptoms are not yet present. One unforgettable example involved a 42-year-old father who came in for a routine eye exam. His optometrist noticed a pale ring around the iris and recommended a cholesterol test. The results showed significantly elevated LDL, and a follow-up heart scan revealed early arterial buildup. Until that moment, he believed he was perfectly healthy. That small circle of color around his eyes became the clue that allowed him to change his habits, lose weight, and start treatment before a future heart event. The practical steps begin with checking lipid levels, reducing saturated fats, adding more fiber, and increasing physical activity, because the eyes often reveal what the heart is struggling to manage. But only knowing this sign is not enough, because the next warning involves unusual bumps on the skin that point to an even deeper problem inside the heart. Number 5, amyloidosis skin findings. Following the subtle ring in the eye, the next sign becomes far more alarming, because amyloidosis skin findings appear as waxy firm bumps on the eyelids, the ears, the neck, or the face, and they often signal that harmful amyloid proteins are building up throughout the body. These proteins are misfolded fragments that the body cannot clear efficiently. Over time, they accumulate in organs, especially the heart, where they cause the muscle to become thick, stiff, and unable to pump effectively. Many Americans mistake these bumps for allergies or harmless skin changes, yet they can be one of the earliest warnings of restrictive cardiomyopathy, a serious condition that grows silently. Doctors in heart failure clinics across the United States recognize these bumps as an important diagnostic clue, because amyloid deposits often appear in the skin before major symptoms develop. One striking case involved a 68-year-old woman who had tiny waxy bumps near her temples that she ignored for years. When she later developed fatigue and swelling, her doctor performed an evaluation and discovered advanced cardiac amyloidosis that had likely been forming for a long time. Those small bumps were the earliest chapters of a story she never knew was unfolding inside her chest. There are meaningful steps to take. Early testing, reviewing medications, checking family history, and managing inflammation play a vital role in slowing amyloid progression. Paying attention to these visible signals gives viewers the chance to act before the heart becomes overwhelmed. But only knowing this sign is not enough, because the next clue can appear on the tongue itself, revealing an even deeper struggle happening within the body. Number 6, macroglossia. As the viewer follows these surface signals from the skin, the next clue emerges inside the mouth, where macroglossia appears as an enlarged tongue with scalloped edges and often reflects a deeper buildup of amyloid proteins throughout the body. Many Americans simply think a large or swollen tongue comes from allergies, dehydration, or minor irritation. However, when the tongue becomes unusually broad and presses against the teeth, creating indentations, it can be a sign that harmful proteins are slowly infiltrating tissues, including the heart. The tongue becomes a mirror to a hidden process that may already be weakening circulation and increasing strain on the heart muscle. Doctors in specialized amyloid centers report that macroglossia is one of the most recognizable markers of systemic amyloidosis and is especially important because cardiac involvement often follows. One compelling case involved a 65-year-old man who kept noticing bite marks and pressure lines on his tongue each morning. He assumed it was due to poor sleep. After several months of growing fatigue, his doctor ordered tests that revealed advanced amyloid infiltration affecting both the tongue and the heart. Those subtle marks had been quietly signaling trouble long before he felt short of breath. The solution involves early evaluation, blood tests, imaging, and lifestyle adjustments that reduce inflammation and support organ health, because early detection increases the chance of slowing progression. Paying attention to a small change in the tongue can reveal a much larger story unfolding silently inside the body. But only knowing this sign is not enough, because the next visible clue appears around the eyes, and it warns of something even more fragile and dangerous. Number 7, raccoon eyes. Flowing naturally from the changes in the tongue, the next warning appears around the eyes, where raccoon eyes show as dark bruising that appears with little or no pressure and often signals that the tiny blood vessels have become unusually fragile. Many viewers assume these bruises come from lack of sleep sinus problems or simple aging. However, when bruising forms easily, especially after gentle rubbing, it may reflect underlying amyloid protein buildup, weakening the capillaries. This breakdown in vessel strength can also appear inside the heart, where stiffened tissues struggle to handle normal blood pressure and circulation. Doctors at several U.S. cardiac amyloid programs report that raccoon eyes are among the most visually striking clues of amyloid disease, and often appear months or years before heart symptoms develop. One unforgettable example comes from a 70-year-old woman who noticed dark patches under her eyes every time she washed her face. She assumed it was fragile skin from aging. When she later experienced shortness of breath, her doctor reviewed her symptoms and recognized the pattern. Further testing confirmed cardiac amyloidosis. The bruising had been her first quiet warning. Solutions begin with medical evaluation, checking for unexplained bruising, reviewing medications, and supporting overall vascular health. Recognizing this early clue can lead to earlier diagnosis and better outcomes, because fragile vessels on the outside often reflect deeper fragility within the heart. But only knowing this sign is not enough, because the next warning appears directly on the skin as a net-like pattern that can reveal an even more urgent circulation problem. Number 8, Livedo Reticularis. As the viewer follows the fragile bruising around the eyes, the next surface clue appears directly on the skin, where Livedo Reticularis shows up as a reddish-purple net-like pattern that signals disturbed blood flow beneath the surface. Many people notice this pattern when they are cold and think it is harmless, because in some cases it fades once the skin warms up. However, when the pattern stays visible even in normal temperatures or appears alongside discomfort, it may point to cholesterol fragments blocking tiny blood vessels, or to an autoimmune process that can place significant stress on the heart and circulation. Doctors in vascular clinics across the United States report that persistent Livedo Reticularis can be a warning of cholesterol emboli, a condition in which small pieces of plaque break loose and lodge into delicate vessels. One memorable story involves a 63-year-old man who developed a lace-like discoloration on his legs that would not go away. He assumed it was poor circulation from aging. When his doctor examined him further, they discovered cholesterol debris blocking the flow in several small vessels. This finding led to testing that revealed significant plaque buildup in his arteries long before a major event occurred. That simple pattern on his skin helped prevent a future heart crisis. The solution involves improving circulation, managing cholesterol screening for autoimmune conditions, staying hydrated and increasing gentle movement, because healthy blood flow keeps the pattern from forming. Recognizing this early signal can reveal deeper problems that are already affecting the heart. But only knowing this sign is not enough, because the next clue appears on the nails themselves, and it exposes an even more surprising connection to the heart. Number 9. Quincke's sign. Transitioning from the net-like pattern on the skin, the next clue moves to the fingertips, where Quincke's sign appears as rhythmic pulsations in the nail beds and often signals that the aortic valve is leaking blood backward instead of pushing it forward with each heartbeat. Many viewers have never checked their nails for pulsations, and most would not expect such a small detail to reflect something serious inside the heart. However, this sign forms when blood pressure rises and falls dramatically with each beat, a pattern commonly seen in aortic regurgitation, a condition that silently weakens the heart over time. Cardiologists across the United States note that Quincke's sign is one of several classic markers of valve trouble, and it can appear long before a person feels short of breath or fatigued. One striking example involved a 59-year-old man who noticed a flickering movement under his nails whenever he pressed them lightly against a bright light. He assumed it was nothing more than a trick of the eye. When he later mentioned it to his doctor, they performed an exam that revealed a significant aortic valve leak. Thanks to that small clue, he was able to begin treatment early and avoid the heart failure that often follows years of undetected regurgitation. The practical steps include regular heart checkups, blood pressure control, and early evaluation for murmur symptoms, because visible nail pulsations are not something to ignore. Recognizing this detail can reveal a deeper rhythm problem inside the chest. But only knowing this sign is not enough, because the next set of clues shows how the entire body can pulse in ways that reveal an even more severe valve issue. Number 10. Corrigan sign, Demusset sign, Muller sign, Landolfi sign. Moving naturally from the subtle nail bed pulsations, the next group of clues becomes far more dramatic, because Corrigan sign, Demusset sign, Muller sign, and Landolfi sign show how the entire body can pulse in unusual ways when the aortic valve is severely leaking. These signs occur when the heart pumps blood out with force, but that blood immediately flows backward due to a faulty valve, creating exaggerated pressure changes that ripple through the arteries. Many viewers would never expect the eyes, the head, the throat, or the carotid arteries to move with each beat, yet these pulsations can be strong enough to notice without medical equipment. Cardiologists in major U.S. heart centers report that these body-wide pulsations often indicate advanced aortic regurgitation, a condition that quietly stretches the heart and can lead to heart failure when untreated. One unforgettable case involved a 61-year-old man whose wife noticed that his head made tiny nodding movements whenever he sat still and listened to music. He laughed it off for years. During a routine check, his doctor examined him and identified a severe valve leak that required urgent evaluation. That small rhythmic motion saved him from a much larger crisis. The solution includes early valve imaging, strict blood pressure control, and regular follow-up with a cardiologist, because these outward pulsations reflect a heart that is working far harder than it should. Recognizing them early can prevent years of silent damage. But only knowing this sign is not enough, because the next warning appears as swelling in the legs and ankles, a change that often reflects an even more widespread strain on the heart. Number 11. Pitting edema. Flowing from the dramatic body-wide pulsations, the next clue settles lower in the body, where pitting edema appears as swelling in the legs or ankles that leaves a deep indentation when pressed with a fingertip. Many viewers associate swollen legs with long days of standing or mild circulation issues. While that can be true, persistent pitting edema often tells a much deeper story about how well the heart is pumping. When the heart struggles to move blood forward, fluid begins to collect in the lower body, causing the skin to swell and soften. The indentation left behind becomes a simple at-home test that reveals pressure building inside the veins. Heart failure specialists across the United States emphasize that pitting edema is one of the earliest and most visible signals of fluid overload, especially when it appears alongside shortness of breath or rapid weight gain. One powerful example comes from a 74-year-old woman who noticed her socks leaving deep marks around her ankles each evening. She believed it was normal aging. After her daughter encouraged her to get checked, her doctor found signs of heart failure and fluid retention. With timely treatment, her symptoms improved dramatically, and she avoided a dangerous hospital visit. The solution includes monitoring daily weight, elevating the legs, reducing sodium, and checking heart function with a medical provider because swelling that persists or worsens deserves immediate attention. Recognizing pitting edema early gives viewers a chance to intervene before the heart becomes overwhelmed. But only knowing this sign is not enough because the next warning shifts from the legs to the lungs, revealing a far more urgent danger that can become life-threatening. Number 12, pulmonary edema. After seeing how fluid gathers in the legs, the next sign becomes far more urgent because pulmonary edema occurs when fluid fills the air spaces of the lungs and turns even simple breathing into a struggle. Many viewers confuse this symptom with asthma, allergies, or aging. Yet when the heart cannot pump effectively, fluid backs up into the lungs and creates a heavy drowning sensation from the inside. One of the earliest red flags is orthonia, a feeling of breathlessness that becomes worse when lying flat and eases only when sitting upright. This shift happens because gravity pulls fluid upward, making it harder for air to enter the lungs. Cardiologists across the United States stress that pulmonary edema is one of the most dangerous indicators of heart failure because it can appear suddenly and progress quickly. A memorable example comes from a 68-year-old man who could no longer sleep in his bed and began resting in a recliner every night. He believed it was age-related discomfort. When he finally sought help, doctors discovered significant fluid buildup in his lungs and advanced heart failure. With medication and careful monitoring, he was able to release more than 12 pounds of excess fluid in just days, and his breathing returned to normal. The solution includes reducing sodium, checking blood pressure, using prescribed diuretics, and seeking immediate medical attention whenever breathing worsens at night because the lungs should never feel heavy or waterlogged. Recognizing pulmonary edema early can prevent a life-threatening crisis before it unfolds. But only knowing this sign is not enough because the final clue reveals itself right at the fingertips and it warns of something even more deeply connected to chronic heart stress. Number 13, digital clubbing, coming from the heavy pressure inside the lungs. The final visible clue shows itself right at the fingertips, where digital clubbing appears as rounded, swollen fingertips with nails that curve downward and create a smooth, shiny appearance. Many viewers think this change comes from aging or everyday use of the hands, yet true. Clubbing is a sign the body has been struggling with low oxygen for a long time. When oxygen levels drop, the tissues at the tips of the fingers grow abnormally, causing the nails to lift and the fingertips to expand. This slow structural change often reflects chronic heart or lung issues that have been quietly building for years. Heart and pulmonary specialists across the United States explain that digital clubbing is strongly linked to conditions that limit oxygen flow, such as congenital heart defects, valve infections, and long-standing heart failure. One unforgettable example involved a 58-year-old man who noticed his wedding ring feeling tighter and his fingertips slowly becoming more rounded. He assumed it was weight gain. During an exam, his doctor recognized the clubbing pattern and ordered testing. The results revealed infective endocarditis, a serious infection of the heart valves. Thanks to that single surface clue, he received treatment in time and avoided a life-threatening complication. The solution begins with checking oxygen levels, reviewing heart murmurs, screening for infections, and seeking medical evaluation whenever the nails begin to curve or the fingertips appear unusually bulbous, because healthy fingers should maintain their natural shape. Recognizing digital clubbing allows viewers to uncover hidden issues that the heart has been fighting silently for far too long. But only knowing this sign is not enough, because what comes next ties all 13 clues together and reveals the larger story of how the heart speaks long before symptoms begin. As he reaches the end of this guide, he has seen how the body often speaks long before the heart cries out for help. 13 visible signs have shown him that the skin, the eyes, the nails, the legs, and even the breath can reveal powerful clues about circulation, oxygen levels, and hidden pressure inside the heart. These clues are not meant to create fear. They are meant to create awareness because early knowledge gives him a chance to protect the life he values and the independence he wants to keep. The heart does not stay silent by choice. It sends gentle messages, hoping someone will listen before danger grows. Here is the hopeful truth. Many of these early warnings can be improved when he pays attention to small changes and acts with intention. Checking blood pressure, regularly reducing sodium, staying active, Eating heart-smart foods and staying hydrated are simple steps that help the heart work with less strain. Even small adjustments can bring real relief. The body always tries to heal, and every choice he makes can support that healing. There is always room for progress, and it is never too late to start. If this video has helped him understand his heart better, he may want to save it so he can revisit these signs whenever he needs a reminder. Someone he loves may also need to hear this message today. He can subscribe to the channel to receive more clear and practical health guidance focused on senior wellness nutrition, early warning signs, and safe everyday habits. New videos are added often, so he will never miss the knowledge that could protect him. In the next video, he will discover simple daily choices that lower blood pressure naturally and support steady energy through the day. Until then, he is encouraged to stay curious, stay proactive, and stay kind to his heart because it has carried him through every moment of his life.